The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
It's only November and already a surge of viruses among children is straining the best efforts of parents and doctors. We'll find out why tonight. Then, as it's Treaties Recognition Week, our Ontario Hubs report on the connection between one treaty in Northern Ontario and residential schools. Also, from this week's Labour Showdown to how to build more housing in the province, we've got the agendas we can review. It's Friday, November 11th, and that's all ahead on the agenda. This week, doctors in children's hospitals across the province sounded the alarm that this was going to be no ordinary flu season. Already, pediatric ICU capacity is at or beyond its limits, and parents aren't far behind. With us now for more in London, Ontario, Dr. Rod Lim, Site Chief of the Pediatric Emergency Department at the Children's Hospital at London Health Sciences Centre and an Associate Professor at Western University. And here in our studio, former director of the COVID-19 Science Advisory Table, Dr. Farhad Razak, who is an internist at St. Michael's Hospital and assistant professor at the University of Toronto. Hi to you both.
Hi, good to be with you.
We really appreciate your time because we know right now it's such a taxing time. Dr. Razak, I want to start with you. We're hearing about a host of viruses affecting children in the province at the moment. Can you clarify what viruses we're talking about?
Yeah, Nam, it is a very difficult time, and what we're seeing right now is a resurgence of some of the viruses that we hadn't really seen very much over the last couple of years. So we're seeing a high rate of influenza, the flu spreading, RSV, and then other respiratory viruses, and along with still some COVID cases in children as well. This has been called a triple-demic because it's these three viruses coming up together. The important thing for our emergency resources for parents is that kids are getting sick, and getting access to care is increasingly difficult right now.
We're going to talk about that because even now you can't even go to a pharmacy to get Advil and Tylenol. Dr. Lim, compared with last fall, are we seeing an increase in respiratory illnesses among kids in this province?
Oh, I mean, that's an easy comparator because last year, really, we didn't have any influenza and RSV season at all. Even based on historic numbers from before the pandemic, what we're seeing now is really unprecedented. It's very early. Viruses are circulating in unusual times. We had RSV in the summer, which is, again, I've never experienced in the 22 years that I've been working. And influenza has come early. So I agree that the viruses are here. It's early, and we are anticipating quite a difficult fall, winter.
Can you explain to us why it's happening this year? Why it's happening now?
Yeah, I think most of it is that we've had a sheltered population for about 2.5 years. We had almost no flu activity last year at all. And if parents remember what it's like when children first go to daycare or first go to school and they're sick all the time, we just have a large proportion of children who are ready to become infected. And we've certainly had relaxation of a lot of our public health measures. So children in schools, people at work, lots of ability to transmit the virus. And usually the virus likes colder weather and more indoor congregations. So the fact that we're seeing it already now when the weather is just beginning to cool is quite concerning. The numbers that we're seeing right now are through the roof. This is going to be our busiest November of record. We are built for about 100 visits a day, our capacity, and we have hit over 200 just 2-3 days ago.
Wow. The cold weather is not here yet.
No.
And Dr. Lim mentioned that we, over the past few years, we've been in these sheltered environments. Do we know roughly how many of these are due, what's happening right now is due to COVID versus the seasonal flu versus other illnesses?
For kids right now, the majority of illnesses that are happening are not COVID. It's still the traditional viruses that would circulate heavily prior to the pandemic are now making that resurgence. So it's predominantly flu, RSV, and other respiratory viruses. And just to give a sense of how different this season is versus what we had during the pandemic, On a typical year, there was a study across Canada that looked at about 90% of children's hospitals, and you would get about 1,500 admissions for influenza in kids on a typical year. From 2020 to 2021, there were 0 admissions, 0 for children during that period, and now you're seeing this enormous surge. So you're getting a wild swing, and you can really see the suppressive effects of what happened during the pandemic.
Can you explain to parents why that it's happening now? Because I think a lot of us are kind of like, if kids used to get it before, I understand when we were masking and maybe we were keeping away from each other, but why is it happening now?
Yeah, so you have a cohort of children that were born and are young who really experienced their lives during this pandemic, so with reduced exposure to viruses. And now you're seeing, with schools back and forth, with all of these public health measures that have been lifted, especially in schools when you have a lot of kids packed in together, that is the environment where viral spread occurs. So you're getting these viruses just racing through the pediatric population, and you're getting this surge, which is, as Dr. Lim said, is frankly worrying because it's only November. What does this look like over the course of the respiratory virus season in December, January, and February? That's the great worry. We've already outstripped our existing baseline pediatric ICU capacity in the province. We blew past it this past week. Now, look, everyone in the hospital sector, we will rally, we will do our best, but all of you know that when you're past capacity, at that point, you're triaging. You're starting to pull in a resource here, pulling a resource there. It becomes increasingly difficult, and you're deferring other essential parts of the healthcare system, like scheduled surgeries, routine follow-ups. All those things get pushed back.
Okay, I'm going to come back to the impact and some of the solutions. Dr. Lim, you mentioned RSV. What is that?
Yes, it's a lot of parents don't think about it after their children are a little bit older. It's respiratory syncytial virus, very common. Tends to just cause cold-like symptoms in older people, but it's the very young that we see it that has a tremendous impact. Children under 2 years of age, they can present with a lot of breathing difficulty, sometimes feeding difficulty, sometimes apneic spells, and certainly, we are very used to having an RSV surge in the later months every year at children's hospitals. It always taxes our capacity because it is such an impactful virus. But this year, it's the enormity of the number of young children that we're seeing come in that require respiratory support, that require advanced machines and things like that to support some of the young children coming in is certainly something that I've not seen before.
You must be worried because we are talking about we have limited beds. We have children are being moved from pediatric hospitals to adult ICUs. This must concern you.
Well, I mean, nobody takes care of children that aren't passionate about children. At the end of the day, we need to provide, empathetic, compassionate, excellent care to all children. And right now, it is a real struggle. We are trying to be as creative as we can. We have literally set up so many chairs in our hallways where we're seeing patients who have waited way longer than we're used to, which is extremely taxing for parents, very stressful for the parents. But, this is a team of incredibly skilled and dedicated individuals that are forced to be incredibly creative right now under very trying circumstances and working incredibly short. The human resource issues right now that we're facing are compounding the huge amount of work that has to be done because of the acuity and the number of patients that are coming in. These people that are showing up, they have my, absolute admiration. They're fantastic people trying to do an incredibly difficult job in an incredibly difficult time.
And, I'm a parent, you're a parent, we never want to see our kids struggling. And I want to ask you both this question, and I'll start with you, Dr. Lim, first. If the current surge in hospitalizations continue, will hospitals have to start triaging children?
Triage is a broad term. I mean, to some extent, right now we are moving patients around, community hospitals to tertiary care hospitals, sometimes to adult hospitals, depending on the support that they need. I've just firsthand, in terms of the local environment that I've seen, people are bending over backwards to try to support each other and to try to create that safety net that's so important for children. I don't think any of us want to see something that is curable, treatable, come to harm to a child. I don't think any of us can fathom, that kind of reality. The amount of energy that these people are putting together to try to stay coordinated I just cannot emphasize much. Picture the most busy airport you've ever seen and double it. We are running around trying to do our best and trying to stay human because we know this is so stressful and so hard for parents. So we aren't at that point right now. We're certainly moving a lot of these resources around and trying, but yes, of course, that is what we worry about.
It's really hard to imagine the scenario that you're painting, that this is happening in the province of Ontario.
Yeah, I totally agree. And what Dr. Lim's describing are these heroic efforts to rally in every sector, to pull on some of the pediatric staff from one area, to move some kids over to adult hospitals. But remember, those other sectors have also been stressed repeatedly for the last 3 years, upon wave, upon wave, upon wave. And if you look at the adult hospital sector, which now being asked to start to absorb some of the older children and provide care if needed, the adult sector right now has just gone through a summer wave of cases that they've had to manage, and they are looking towards potentially a fall and winter wave of influenza. I'll use my own hospital as an example. In the winter before the pandemic started, this was pre-COVID, our volumes increased by nearly 50% in a flu season. So if that same sector is now being called on to rally to help with the pediatric hospitals, what happens over the next 8 weeks if an influenza surge dumps a lot of patients into the adult sector? So these are the trade-offs, and it's very difficult to see how the pieces can continue to be rearranged.
It seems as if you're all playing like a game of Tetris, except this is not a game. Dr. Lim, does this mean that you're taking away resources from surgeries and other treatments to handle what's happening right now?
Yeah, I mean, if you look at the publications around what's been happening at Children's Hospital of Eastern Ontario, where they've opened a second pediatric ICU, they have had to make some difficult decisions and cancel some scheduled surgeries. There always has to always come from somewhere, and obviously things that we don't like to see delayed. Sometimes people have to make the difficult decision that that's the best interest in the time that we're facing in that exact day. So there is a lot of movement around, but it comes from somewhere. And someone is always being affected by all the choices that are being made. So, we try to make the best choice for the greatest need at the time. But none of this does not impact down the road, for sure.
We know that in this province, there's a lot of families that don't have family doctors. And now parents, when they go to pharmacies, they can't access Advil or Tylenol. To what extent is this contributing to the pressure on what's already happening with pediatric hospitals in this province?
Yeah, undoubtedly this is contributing to it. So you have approximately 2 million people in Ontario who don't have access to a family doctor. Many of these kids now are getting sick, either in schools or exposures in other places. When they're sick, they don't feel well, their throat is sore, they have high fevers, and now we're having trouble getting access to pain medication. This is something that our family has run into as well. So what do you do as a worried parent at that point? You take your kid to urgent care, and that's part of this influx that you're seeing. So it's a very difficult situation, and the problems with getting access to pain medication, I have to say, this has been 6 months now. Mm-hmm. There should be solutions in place at 6 months. I understand acute shortages, but 6 months of shortages is a very long time for medications that are routinely available across the world.
You hear this sentiment from parents that they're very frustrated, and obviously maybe my view is kind of tainted because I am a parent and I've been in that situation where I'm trying to find Advil and Tylenol, and we're trying to find solutions of what to do. Dr. Razak, there's been some discussion around the Ministry of Health bringing back mask mandates next week to curb the spread of these viruses. Where do you stand on this?
Look, I think mask mandates are a very difficult issue, and they've been highly divisive over the course of the pandemic. But what you've seen is that people in Ontario, Canadians in general, when asked to do this, would willingly follow through with mandates, understanding that it's a targeted strategy, it is a blunt tool, but often it's a tool of last resort when you are seeing the crises we are seeing currently. So there was 2 polls done this week, which are very informative, I think, in thinking about how the public is thinking through this issue. One was by Nanos, the other was by the Public Policy Forum. Both suggest that roughly 7 to 8 out of 10 people are already wearing a mask or would be willing to put on a mask for a mandate in crowded indoor settings if asked to do so. I think it highlights that you have to give people a rationale. You have to say, this is why we're doing it. This is a strategy to help our system. And people, by and large, would be accepting of it.
I'll just push back a little bit. What I've been hearing, the discussions is to have the mask mandates in schools. But, kids are part of communities. And would it make sense to have a mandate if people are not buying into it?
Yeah, look, I think that we have asked kids to do a lot over the pandemic. If you look at Ontario and if you look at Canada, we had some of the longest school closures of any comparable wealthy country. Those school closures were often rationalized to protect the adult healthcare system. So we closed schools to protect the adult healthcare system. I do not think that we should be asking this of children without asking something similar of adults. So if you're going to do this, you should at the very least have masking within busy public settings that everyone goes into, within transit, grocery stores, healthcare settings. It would be, I think, unreasonable to just ask for a mask mandate in schools. Now, still there's going to be spread. There's going to be spread, but it would be an attempt to reduce that spread as a starting point to see whether we can start to blunt some of what Dr. Lim and colleagues across the province are seeing. I think it's a starting point, and it will take time to work, and there is a real urgency right now to the crisis.
Dr. Lim, Ontario Minister of Health, Sylvia Jones, released a statement earlier this week saying pediatric hospitals had the full support of the government. Could the government, in your view, have been more proactive in placing some measures before we got to the place we are at now?
You know, that's an excellent question. And I think even broader than that, if I may, seasonal variation and pressures have been a reality since I've been a physician. So for over 20 years, we know capacity in the wintertime is always a difficult situation. And what I think about when I hear the conversations that we're having is, how can we be proactive? I know we're in a fire right now and we need immediate solutions, but these questions are going to be with us next year, the year after that, and the year after that. And when are we going to talk about investing in healthcare to the point where we have capacity? We are able to not run so close to full at all times for efficiency, so that we have options and ability to flex up when things happen, and we don't have to push buttons in terms of, when we're in emergency situations. I think, when I look at the state of manpower in the nursing profession specifically, how decimated that profession has been over the last year, and how long it's going to take for us to rebuild that important aspect of our healthcare system, we need to be having those kind of conversations and very thoughtful conversations about the type of system that we need that's healthy and resilient and able to respond to these surges that are anticipatable. Like, we know this is going to happen. We know it's going to happen again. And we can't wait for these things to happen and try to juggle things every day when we know that this is our future. So I think we just have to have these important conversations and planning, because I think the more coordinated we are and the more thoughtful we are with these solutions, the better they're going to be.
And Dr. Razak, I want to ask you that same question. Could the government have done something earlier?
Yeah, my personal feeling on this is that these mandates should have been, or at least a very strong encouragement. You don't have to move right to mandates, but a very strong encouragement with clear leadership from public health around using a mask, the necessity of it, the crisis, wearing that mask publicly in all settings to show people how important it is. That should have already happened. But, there's a proverb: the best time to plant a tree was 20 years ago. The next best time is now. We're now. So what can we do now? I think at the very least, there should be extremely strong public messaging to say it is critical. Wear your mask every crowded indoor settings. Many people, including myself, think that because of the pace of spread now, we're even past that part. We have to go fully into the mandate requirements in transit, grocery stores, essential public settings. People can still go to other places on their own risk. This shouldn't affect restaurants or gyms or other places. I'm talking about places where people have to go as part of day-to-day life. They have to get to work on a bus or on the subway. They have to be in school. They have to go into a workplace. So these are the areas where I'd like to see it in place.
And it also seems as if we are kind of, journalists anyway, are kind of hungry for data, because we don't have access to the information we had maybe a year ago. Even for the public itself, we used to have updates on TV, on reports. So when it comes to testing, do we need to test more?
I think it would be helpful. The data on influenza testing right now already is a warning signal. So an influenza season is declared typically when more than 5% of tests are positive. We blew past the 10% mark in the last week. So it's clearly showing there's a rapid surge. It's also occurring very early. And we have data from other parts of the world, like Australia, to suggest it could be quite a severe season. COVID testing is something where I think there would be a lot of value in bringing in more enhanced COVID testing. We've lost the ability to really get a sense of how this virus is spreading across the province right now. Again, it is not the only challenge in the system, but I do think that data to get a sense of COVID, influenza, RSV, when you put that together, you can really paint a much clearer picture of where you need to prioritize and the degree of acceleration. We've lost some of that now.
And, since I have both of you here, we're talking about masking mandates, and I think earlier in the pandemic, people were maybe more agreeable to do it, and you've both been working in an environment where you're trying to keep us safe and healthy while you take care of yourselves as well. And I just wanted to ask you both quickly, Dr. Lim, I'll start with you. What keeps you going in an environment where you're trying to keep people safe, and then there just seems to be this divisiveness and maybe lack of information that people are trying to understand where we are right now?
Yeah, I mean, I'll start to say that, I just want to bring up at the point that I mentioned the nursing force, the physician force we know is getting increasingly unwell and burnt out and facing extraordinary pressures. And we also have to have a very conscientious conversation around physician support and physician health. I think for me, I've always just tried to look at the big picture. There's things that I cannot control, which is the environment that I'm working in, the degree of sickness that's out there. But what I can control is I can help the people that are in front of me, and I can advocate for systems to respond to the needs of the people that I'm trying to help. If I keep my eye on that, and I keep my eye on the patient that's in front of me, even if I'm seeing them in a chair, after they've waited a huge amount of time, I know that I can continue to do, and my team can continue to do a good job to help them, even under extraordinarily difficult circumstances. It is a pleasure to serve in healthcare, even under extraordinarily difficult times. And I'm going to put a big shout out. I cannot thank the people that show up every day right now under extraordinarily difficult circumstances, and they're doing very important and incredible work.
And Dr. Razak, I think one part of this is that parents just don't know what to do. Yeah. What advice would you give parents who have a sick child but can't access medicine and might not have a family doctor?
Yeah, I'll just start by echoing Dr. Lim that it's a privilege to work in the healthcare sector, but it is increasingly a heavy experience and it's exhausting, and I do worry about resilience. To the question about parents, remember that we in the hospital sector, both for pediatrics and for adults, we're dealing at the very downstream end of a sequence of events. So what we need people to do is to do as much as they can upstream to try and reduce infections. It's the things that we have talked about. It's getting your vaccines up to date. There is an influenza vaccine right now where uptake has been relatively low. It looks like it's a very good match for the virus that is circulating this year. Please go ahead and get your influenza vaccine. It takes a couple of weeks to be fully active. We're in a surge now. If your COVID vaccines are not up to date, now is the time to get your COVID vaccines up to date. And then the public health part of this. So wearing a mask in indoor crowded settings, a good quality mask. If you can wear a respirator, great. At least a surgical mask, if not a respirator. Reducing exposure events. So if you're sick, don't go out into that crowded indoor setting and expose a lot of other people. So it's the things that we've always talked about. It's the strategies that we have left to us that could be important over the next 2 to 3 months, which is what we're really talking about. And then it's the longer term solutions, which the government, policymakers, public health have to sort out, staffing, capacity. But for parents, for all of us individually, do what you can now to protect and reduce the chance that your kid is going to get infected.
Dr. Razak, Dr. Lim, thank you very much for your time. We really do appreciate everything that you're doing for the children in this province and for us as well. Thank you very much.
Great to be on.
Thank you.
Since 2016, Ontario annually marks this as Treaties Recognition Week. Charnel Anderson covers the Northwest for Ontario Hubs, and she joins us now from Thunder Bay for more about the Robinson-Superior Treaty of 1850, which covers a huge swath across the north shores of Lake Huron and Lake Superior. Welcome, Charnel.
Hi, Dan.
All right, so the treaty I mentioned, the Robinson-Superior Treaty of 1850, has some special significance to one Thunder Bay man you spoke to. What's the family connection there?
That's right. So for this piece that I worked on, I spoke to David Thompson, who works at Dennis Franklin Cromartie High School in Thunder Bay, and actually one of his relatives. So it's his grandfather's great-grandfather. So that would be his great-great-great-great-great-grandfather was. His name was Chief Manadogene. And so Chief Manadogene was an indigenous leader in the Lake Nipigon area in the mid-19th century. And so this was, during a time of rapid European expansion. There were government agents traveling around looking for natural resources and trying to negotiate treaties with, the indigenous people that lived in the area so the government could access those natural resources. And so the government agent had met Chief Podichat of Fort William, who they had considered the spokesman for the Anishinaabe groups in the area, even though these were distinct groups. But the government agents and Chief Podichat were able to negotiate the terms of a treaty, and eventually in September of 1850, Chief Podichat and Chief Manadogene and others traveled down to Sault Ste. Marie to sign the Robinson Superior Treaty, which, of course, forms the basis of the relationship between Indigenous groups in the region and the Crown.
So, as you mentioned, there's a lot of history there, and I'm curious, how did he discover that history and go back so many decades and family generations?
So David spent a lot of time with his grandfather when he was younger. During the summers, they would go visiting the Lake Nipigon area where they would spend time fishing at his grandfather's uncle's fishing grounds, trying to catch whitefish. And, David was pretty young during this time, but he would listen to the conversations that his older relatives were having, about their family and about residential schools and about their family that didn't come back from residential schools. And, as a young kid, David says he didn't, fully understand or appreciate the stories that he heard. But of course, now as an adult, he sees the significance of these stories and the events that they recount and how they're tied to the present. Because, on one hand, it is his personal family history, but the stories also reveal a lot about the history of the region and these events that have led us to where we are today.
I want to talk about the chiefs that signed the Robinson Superior Treaty in terms of education. Did they want a sort of European settler education for their children? What was sort of the scope in terms of what they wanted?
Yeah, so many of the chiefs did want European style education because they had seen the changes that were happening around them as a result of colonialism, and so they wanted Western education to kind of augment the traditional knowledge that was already being passed down, in order for their communities to adapt to the changes that were happening. And so education wasn't an explicit provision in the Robinson Superior Treaty, as it is in subsequent treaties. But David said that Chief Manadogene's understanding was that, if he had signed the Robinson Superior Treaty of 1850, the Crown would provide a teacher for his community. He told his community members as much and asked them to wait for a teacher to come, and when the teacher did come, to embrace them. And sadly, Chief Manadogene died waiting, but eventually a teacher would come to the Lake Nipigon area.
Of course, what they asked for was not what they got. Ultimately, it was residential schools. When did what they wanted transition sort of into what they got?
So the seeds of what would eventually become the residential school system were actually already planted before Chief Manadogene had requested a teacher for his community. The first residential school opened in the 1830s in what is now Brantford. And so that's, 20 years before the signing of the Robinson Superior Treaty in 1850. But I think, because Northern Ontario and, the Lake Nipigon region in particular was so remote and isolated, it took a while for missionaries and government agents to get up here and for the residential school system to spread. But I think a good example of this phenomenon is the Shingwauk Residential School, which was named after Chief Shingwauk in Garden River, who had a vision of education for his community that would preserve Anishinaabe knowledge while also teaching Western knowledge like reading and writing in English. But as Paul Sayers, who works at Algoma University, and he's actually a descendant of Chief Shingwauk, as Paul told me, even though the school was named after Chief Shingwauk, his true vision wasn't manifested in the school. The Anglican Church, which ran the school, had appropriated his vision and turned it into the Shingwauk Residential School, which, of course, ultimately played a role in, the cultural genocide of Anishinaabe people.
All right, I want to show a brief clip of your interview with David, just talking about sort of the education system and really sort of the next steps moving forward. Let's have a look at that.
We are the grandchildren and children who are still living with the fallout from that those past traumas, and but we're very resilient people, and we haven't forgotten, or at least we've been taught, to be proud of who we are as Anishinaabe people, and then who we were and who we are and who we can be is still real for us.
Now, you had mentioned Chinook Hall Residential School, Sault Ste. Marie. That's 600 kilometers east of where David grew up in Nipissing, but he does have that family connection. Talk to me a little bit about that connection that he has with that school so far away.
So, after the Chinook Residential School was built, and before there was a school in Lake Nipissing, E.F. Wilson, who was a missionary, but he was also Chinook's first principal, him and Bishop Fauquier, who was an administrator at Chinook, went on a missionary tour to Lake Nipissing. And, as I mentioned, the community in Lake Nipissing was waiting for a teacher to come. And, Wilson explained, that's not what we're here for, but we can take back one or two kids to Chinook so they can go to school there. And so the chief at the time, who was actually Chief Manadogéan's son, offered to let the missionaries take his son, called Ningwenana, back to Chinook. And so that's what they did. But sadly, Ningwenana got really sick, and within, I believe it was about 8 months, he ended up dying at Chinook from tuberculosis. And so he was the first of David's relatives to die while attending Chinook. But 3 more of David's relatives, Kathleen, Fred, and Frank Manadogéan, also died while attending Chinook. And, so every year or so, David goes down to the Chinook Cemetery in Sault Ste. Marie to visit Kathleen, Fred, Frank, and Ningwenana. And, he's brought his daughter there when she was born, and he plans on taking, his young grandson there as well, as he said, to ensure the continuation of his family history.
Well, my last question to you, David is an educator in Thunder Bay, and I want to read a quote that he says. He says, "It's amazing how much knowledge and wisdom there is in Anishinaabe education. It's not something of the past." How is he working to reclaim that?
So David works as a land-based coordinator at DFC. And, so there he teaches the traditional Anishinaabe practices that he had learned from his grandparents. So they'll go out, it really depends on the time of year, but they'll go out and do everything from goose and duck hunting, fishing, setting snares, berry picking, wild rice harvesting, you name it. And, he does this in a way so that it connects with the curriculum. So he'll work with the math and science teachers to find, a land-based activity that connects to the curriculum. And so, it's this really neat fusion of traditional Anishinaabe practices and the standard curriculum, which, feels like it aligns more with, the vision that Chief Manadogéan and Chief Chinook had for education for their communities.
Charnel, really great story, really great stuff. Thank you so much for joining us on the program.
Thanks, Jan.
The agenda this week assessed efforts to get more houses built in Ontario, examined the immigration backlog, and learned why our brains may be hardwired to keep us from reacting to threats as big as climate change. The agenda's week in review begins with labor rights and the notwithstanding clause.
The strike card is a very powerful card to play, obviously, right? When kids are out of school, parents are upset. And they're not just upset at the government, they're upset at the unions, they're upset at everything. They just want the situation to be fixed. But that being said, the government can't just back down every single time that card is played, because if they do, it's going to be played all the time in every single situation.
Allison, you want to come back on that?
Well, yes. I think it's important to note that, of course, we are not at the table, right? So, I don't know, and no one who's not really there and who hasn't been living and breathing this for weeks and months really knows all the nuances and the back and forth. Catherine, you yourself say you negotiate, then you know these things. I don't know how much longer the union is supposed to negotiate with no traction. Is it another month? Is it 5 months? Is it 2 years? It's not for us, I don't think, to second guess. But I think it's also important to note that it's a rare thing to use this lightly, largely because unions know that they run the risk of being legislated back to work. So this characterization that unions willy-nilly drop the strike intent every time it's not going their way is fundamentally poppycock. It's a considered decision. It's a thoughtful decision. It's a very hard thing to be on a picket line. I don't know if you've ever been on one, Catherine, but it's a hard thing to be on a picket line. And it's a hard thing to lead a strike. I don't know if you've ever done that either. So it is not a willy-nilly thing that unions do, at least not in this day and age.
Okay, speaking of just because you can doesn't mean you should, that leads me to the notwithstanding clause. Because the reality is it has been part of the Charter of Rights and Freedoms. The opportunity to use the notwithstanding clause has been in the Charter of Rights and Freedoms since 1982. But in its wisdom, no previous government of Ontario has ever used it or even mused about using it, threatened to use it, and so on.
Or any other province.
Well, Quebec.
I don't think it's been used. In Quebec, was it used to impose a contract?
Oh, that I don't know.
That's what I mean in a labor dispute.
Oh, I see what
my
you're saying.
apologies.
In a labor dispute. Right, right. So I guess my question is, this is now, I mean, Doug Ford used it, Cynthia, to bring in campaign finance reform.
Yes.
He threatened to use it to overturn a decision about the size of Toronto City Council, ultimately got a better court decision, didn't have to do it. Threatened to use it in this case as well. Again, rescinding for now. I guess the question is, just because you have the power to do something, should you do something? Want to get into some discussion about that?
Well, I think this morning Doug Ford proved maybe not.
I mean, it's there in the Constitution. It's there in the Charter. So some people have said if it's there, you ought to be allowed to use it. Others have said it's not a coincidence that it hasn't been used in the last 36 years. Mm-hmm. Where do you think the preponderance of evidence comes down in this case?
Well, I think with public perception, I think from that poll, if we're going to believe that poll, I think people are uncomfortable with the use of it in this situation. And I think Doug Ford got that message loud and clear, and I think that's why we're seeing what has transpired this morning.
What about it, Catherine? Do you think the circumstances of this situation justified the threatened use of the notwithstanding clause?
Overall, I think the circumstances did justify it. You know, Allison, no, I've never been on a picket line or led a union movement, but I've sat down with a very frustrated, upset 6-year-old and tried to teach her core skills when I'm not a trained teacher, and seeing her be isolated and lonely and crying and missing her friends. And you know, fundamentally, the government has a really important role, which is obviously to protect our public institutions. And at the end of the day, you know, they have to, yes, the core rights are really important that are enshrined in the Charter, but what about the rights of the millions of kids to be in school? And that isn't something to be overlooked. And look, I don't think that the notwithstanding clause should be used lightly. I mean, it is used frequently in Quebec. We do tend to forget that. I think we're probably going to see it used more in the labor context. The right to strike is a relatively new one. It wasn't recognized until 2015. And the reason why we're going to see it more frequently in the labor context is with public sector unions. If there is a strike and there is a shutdown, it impacts millions of people. And there's plenty of people who would argue that education workers are essential service because school and education is essential. So I think we're actually going to see it used more often, hopefully not lightly, but this isn't the end. This is a new time, I think, for labor public sector negotiations.
Well, listen, I think it was Andrew Coyne from the Globe and Mail who said if you leave a loaded gun lying around long enough, someone eventually is going to pick it up and use it. And it may be that for 36 years, no government of Ontario took this path, but this Premier clearly has a different view of it. Is the clause there to be used, in your view?
Not in the case like this. I mean, it's absurd, frankly. And I'll tell you why it's absurd. Because if the one thing that I think most commentators can agree upon is that it was not meant to serve every political peccadillo that any government has, then how do you use it in the context of a right that, although, yes, only given constitutional protection in the last 7 years, has been around very much in the same form for almost 80 years. The statutory framework that we have developed over 80 years that allows for the designation of an unlawful strike. And think about that for a moment. We don't have a dictatorship dictatorship. We don't have a slave economy, but you can be fined for not going to work. That's an unlawful strike. How do you make a strike unlawful in the context of a democracy? Well, you do it because you exchange something for it. And what you exchange for that labor piece, for labor to buy into the fact that they can't just walk off the job every time they're unhappy, that they have to stay there while there's a contract in place, then you give them a means to achieve that decent contract.
We have always been a bit of a outlier relative to the industry in that we fundamentally believe that we are stewards, we are not owners. And as generational stewards, the decisions we make today and the implications they have for future generations needs to be fundamentally considered. Our industry has been stuck doing things the way they've always known how to do them, but it's time for innovation. It's time for change. We need to be thinking about the environmental impact that our buildings have and the way that we build our cities and the contributions they have to both the carbon footprint, but to the broader sort of environmental assets that we have. And so I completely concur that it can't be a wholesale sort of approach where you sort of, you don't build housing at any cost, because the housing is part of an ecosystem. It's part of society, and the environmental contributions and the environmental role are fundamental for future generations, and we can't sort of spite them in terms of just trying to deliver what we need today.
How confident are you that at some point, in this orgy to get housing built, at some point somebody's going to build on a floodplain and a conservation authority is not going to be allowed to make a deputation to oppose it, and at the end of the day, this is not going to work out?
I'm 100% confident that if there aren't changes in the bill, which I hope that Ina's right, it will be iterations before it's passed, things will be changed. I'm 100% confident that that will happen. And I think it's important to talk about the environment as something for our kids, but that's not what I'm talking about. I'm talking about things being destructive now. We have more floods already than we experience. If you've been on the floodplain, it's not just that the houses in that neighborhood get flooded. It changes floodplains for everybody nearby. So existing houses also are a higher risk. I'm not talking about things going wrong in 20 years when my kids are grown up. I'm talking about someone buying a house and their basement flooding 2 years later. And what most people don't know is that your home insurance doesn't cover that. Because the risk of flood has been going up so quickly, floods are being pulled out of almost everybody's home insurance. And then also, the bill as currently written makes green standards not viable, which means that all new homes built would be much more expensive to run. And if the bill passes as currently written, I see a thing in a couple of years where we're like, oh, we've got to be careful not to buy a house that came in after 2022 because my energy bills will be twice as high.
I think we have to be a bit careful here, because my understanding of the legislation as it relates to conservation authorities is it's specifically saying conservation authorities should continue to play a role in exactly what you're talking about, of anything that relates to floods, natural hazards, or personal safety. I think the intention is to rein in the level of involvement. And I've got a colleague that runs a habitat in a smaller Ontario community. They've got a 4-unit development that's not even in a floodplain. The fees they have to pay to their local conservation authority for their approval process is more than they're paying to the municipality for the rest of the development fees.
Hold that thought. Would you agree that doesn't make any sense?
Yes.
Okay. Consensus. Keep going.
There you go. So, well, I think that, and I think we are all concerned about things like green standard and the way buildings are built. And for me, when I first heard that, I assume I'm working in the part that's in the unintended, that's an unintended consequence. I think it's being talked about a lot, and I would sure hope to see adjustments that get made as we see this go through the multiple readings.
But I think it also highlights a bigger systematic issue in the process, which we talked about in the kinds of delays, is that the system is working in silos. The departments within the municipality work in silos. Then you have externals like conservation authorities who work in their silos. So all of a sudden, when you're going through an application process, you get clearance from one group, and then another group steps in and says, actually, no, we don't approve it. And then you cycle back again, and then you cycle back again.
What's the alternative to that?
Well, it's about the alignment. Right? It's about having people, it's about actually looking at the inputs to the process and aligning them up front and ensuring that you actually have consensus within the system and everyone shows up as a partner, not as yet another layer to sort of get through.
And I'd say it's about balancing authority. right? And this was, the Housing Affordability Task Force, of which I was a member. A lot of it was about how do we get a better balance, because the challenge is inadvertently in the need to have everyone involved, heritage parks, transportation, local neighbors, that the experience for those of us trying to build homes is housing is what you get. Housing is what comes out the other end, what's left over after you consider all of those things. So I think what the effort here is to say, how do we achieve a better balance of these considerations? Because we do, per what you put on the screen at the beginning, we have we have a real housing crisis for people who are suffering every day because of their need for a place that works for their family.
But Jacob, I gather you would like to see what they're calling more gentle density. I mean, we're not talking about 50-story condos going up in every neighborhood, but somewhat more. Will this get us there?
It'll get us partly there. So, part of that point about triplexes and allowing up to 3 units, it'll get us part of the way there. But what that doesn't help right now, at least, is the part about feasibility on every single plot and making that economically feasible and also physically feasible with all the other rules surrounding.
What happened is by October of last year, the government said, we filled all of the quota for 2022 in October 2021, which is why there was a stop on draws for express entry until July of this year. What that meant was now the pool for express entry had been building up. And as Mikhail has said, express entry is about skimming the cream. So you take the top of whoever's in the pool. Now, when you have an inventory, before usually there's a draw every 2 weeks. People can, you're skimming the pool every 2 weeks. You haven't skimmed the pool for 9 months since October. That cream is very, very thick.
It's very thick, yes.
Okay, and so as a result, the draws have been extraordinarily high. And so what happens is many people who would have other qualified for permanent residence, especially international students who have studied, who have worked, and all of a sudden their work permits are going to expire, there's a big issue.
Okay, do you want to comment on that, or can I read you something?
Well, yeah, I generally agree with what Elizabeth has said. I think I would add just one more thing. With TR to PR, there's again a lack of transparency in my mind. So most of what I've been doing for the last year is taking the government to court essentially on delayed applications with generally excellent results. However, people should not be paying lawyers to file an application for writ of mandamus at the federal court to get the government to do its job. With TR to PR, we've done a few of those files, and we see that there's just no transparency with respect to when a file is going to be processed. The program was meant to be expedited, simplified, etc. We're seeing files that are already pending for 16 months with no end in sight. Those are supposed to be essential workers, healthcare workers, etc. How is that acceptable? That's all I would say on the TR to PR stuff.
Okay, let me read this here, and then Mikhail, I'll get you to comment on this first, because we've seen, well, this is from, I want to read an excerpt from an article titled, "When They Needed Us, They Exploited Us." This is Indian students in Canada. They made front page news of a major news outlet in India last week. And here's an excerpt from this. I want to read this, and then Mikhail, I'll get your reaction to it. The foreign graduates were hoping the permit extension would give them more time to gain Canadian work experience and boost their scores under the country's immigration ranking system for skilled workers. But these graduates got caught up in a backlog of applications that led to a 10-month shutdown of the system to allow the government to process them. Once the system was reopened, the students found themselves competing with pools of immigrants with much higher than normal scores, reducing their chances of gaining permanent residency. And obviously, they're very unhappy about that. Okay, Mikhail, your reaction to all of that?
There's an equity problem, Steve. So the way what economists refer to this as is a horizontal equity system problem. In these kinds of systems, you want to ensure that people that are sort of equal are treated equally in the system. And what's happened here, again, as a consequence of trying to hit this target in 2021 and emptying the pool and then letting the pool fill up, is that we've got these very capable students. I mean, I teach a lot of these students, these international students. They would easily clear the bar, you know, that cream, where the cutoff is for the cream, they would easily clear that. But because the way Elizabeth described it is just perfect, the bar is now so much higher because that layer of cream has increased so much that these students who would have had, you know, no trouble clearing the bar in the past now can't.
So what happens to them?
So that's a good question. So that they're given in Canada, we give these students 3-year open work permits. The question is, what happens to them when those permits end? And that's the troubling issue. Do they stay? Do they work without documentation, thereby potentially becoming more vulnerable to exploitation by employers? Do they try to go back home and get back on a pathway some other way? Do they go back to school? It's all about being on this pathway to permanent residency. And so, yeah, I think, you know, it's the usual thing that these short-term myopic policy decisions often have long-term consequences. And we're seeing the fallout now.
You wrote, when we trigger anxieties, we almost always inadvertently trigger defenses. And when it comes to climate change, these defenses act on everyone from greeny urban liberals to climate science naysayers. Okay, fill in the blanks there. What are some of those defenses?
Gosh, well, we already know so much about how our minds protect us from distressing, unwanted information, just as George outlined in his book. And so we've got already an abundance of insight about this, which can, I think, help us navigate this challenge we're dealing with, these crises. Namely, denial is the obvious, but it's so much more than denial. It's minimizing, it's distancing, there's projection, there's like, it's all on them. There's binary thinking, really the polarization, the black and white, any kind of attempt to simplify and reduce complexity. There's the unconscious mechanism of kind of taking what's potentially guilt-inducing or shame-inducing, like, I'm a bad person because I actually love my fossil fuel powered car, or I love my this or that. If we have these kind of distressing internal feelings, even on an unconscious level, we tend to kind of want to get rid of it and put it out on others. And then that sets in motion this whole dynamic that we see that can make dialogue and conversation and imagination really challenging. So I think the reason why we want to understand defenses is because we want to look at what supports our ability to navigate and work through those defenses. And again, we know a lot about that as well. We know that humans actually need connection and community and support to process difficult information, right? We tend to work really well in small groups, 5 to 7. We also cue off of all the social relationships we're in. But I think where we want to put attention is what are the conditions that allow us as humans to stay with what's hard and stay with what's triggering and foster that resilience to work through it so we can get to, and now what do we want to do about it?
Well, let me pick up on part of that and go to Lise with it, and that is we're, I think, all of us familiar with climate change denial, but there are other less obvious forms, Lise, of denial as well. Do we need to consider some of those here?
Sure. Many of those are unconscious factors, and, you know, some of them, it's sort of climate is a Pandora's box of dark thoughts, really. It requires that we acknowledge that we're not the masters of the universe that we might like to imagine, that the world is not necessarily the safe place that we would hope. It requires that we embrace uncertainty, et cetera. And it also triggers, frankly, our personal sense of vulnerability. That is, that we're going to get old, get sick, and die. And climate is like a metaphor for that. So we're avoidant. But let me just say that, building on that, that there are two key things, and there are all sorts of other unconscious issues. There's aggression, which, as I have to say, that not recognizing what is happening to future generations or even our children today and the cumulative toll is an unconscious form of aggression. And I think some of us, not all of us, but some of us look at this as a sort of a narcissistic rage that they're going to be here and we're not. And also there's anger, I think, at Mother Earth that she's got a timestamp on our necks. So I think there are embedded unconscious reasons, but we'll get to how to get around these, because there are so many ways that we can grab on to these unconscious forces and all these emotions and turn them into constructive action.
George, let me get you to comment on something that was written by Michael Hoekster, the research scholar from the Global Institute for Sustainable Prosperity, who has coined this term soft climate denialism. And here's what Michael writes. He says, soft climate denial means that one acknowledges in some parts of one's life that climate change is real, disastrous, and happening now, but in most other parts of one's life, one ignores that anthropogenic global warming is, in fact, a real existential emergency and catastrophic. And I wonder, could you speak to this notion of other softer forms of denial being more widespread and dangerous, potentially, than the actual factual denial of climate change?
For a long time, it was the case that if you asked people, is climate change serious, you concerned that large majorities would mention it. But then if you asked them to name the things that they were really concerned about, climate change wouldn't figure. That there was this ability when you were asking people to focus on it, that they said, yes, I really see that this is a problem. But it immediately just drifted away. It dissipated in the air when you tried to ask people to bring it to light. However, I have to say, this is weakening. I think that the difference between these two forms of knowing and not knowing is getting less with time. Certainly, we've already heard that climate change feels distant to people, but actually it's becoming more and more real for people.
That's just some of what we covered this week. You can find more, including the full conversations, on our website, TVO.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, November 11th, 2022. Monday, Jayan Jagannathan finds out how COVID-19 leaves a lasting impression on our immune systems. I'm Nam Kiwanuka. Thanks for watching TVO and for joining us online at tvo.org. Have a great weekend, and Jayan, we'll see you on Monday.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.